Well, hello, everyone, and welcome to the program today. I'm Carolyn Colley, and I'm president of the U.S. Chamber of Commerce Foundation. At the Chamber Foundation, our mission is to educate the public on how business does well, does good, and prepares for the future. And our entire team comes to work every day knowing that business is an essential problem solver. And that belief has become even more core to our mission since March 2020, when we pivoted just about all of our programming at the foundation to the pandemic and to recovery to a good economy and recovery to healthy people. And since that time, we've hosted business leaders, community leaders, message experts, public health experts from all 50 states in conversations on everything from a responsible reopening strategy to how to plan for a post-pandemic world. And with the approval of safe and effective vaccines last year, that post-pandemic world started to feel a little bit closer. But with it also came the reality that vaccinating Americans would be complicated and hard and a real challenge. We're seeing that play out every single day. 9 months ago, we hosted our first event on the role of employers in this topic. And we focused at the time on vaccine hesitancy, particularly in communities of color. We talked to public health experts and communications experts about what messages and indeed what messengers could resonate most and how employers could help engage their employees, educate their employees, and get us all on the road to vaccination. And today, 58% of Americans are vaccinated, according to the CDC, and we should certainly celebrate that. But it also means that 11 months after vaccines were approved as safe and effective, more than 40% of Americans remain unvaccinated. And the issues have moved on. It's really no longer an issue of hesitancy as it was when we started doing these programs. These are active decisions being made. So we're looking now at how to close that gap, what we hope is this last mile, in examining who is choosing to remain unvaccinated and why, and what are the most effective ways to make the case and close that gap. So it's our pleasure today to hear from two experts with new data and new recommendations. We hope positive news about how we can do that. And of course, on top of all of these challenges, employers are having to navigate federal mandates to have their employees vaccinated. On November 5th, as we all know, OSHA released the final text of the emergency temporary standard, requiring companies with 100 employees or more to have their employees vaccinated or submit to weekly COVID testing and show they're negative. Now, there may be a lot of disagreement about that new regulation, but our focus today is on preparing employers and supporting employers, not weighing in on those disputes. So over the next 30 minutes, our speakers will address where public opinion stands today on the pandemic, vaccines, mandates, and more, and how to have productive conversations. How can employers step in and really help close that gap by having productive conversations with their employees in the coming weeks? We think we're up for the challenge, and we hope that you'll consider all of this information at the Chamber and the Foundation a resource for you. I know you've got a lot of questions, so please enter them into the chat throughout the program, and we'll do our very best to get them answered during the Q&A session at the end. We've got a lot to cover, so let's get started. Thank you.
Hi, everyone. I'm Carrie Shum with Hadaway Communications, and we are a strategic communication firm and have been working with the Rockefeller Foundation over the last 16 months to really look at what people think, what they're doing, and really importantly, what messaging we can use to get them to think and act differently around things like all of the things we've been asking people to do around the pandemic. So if we can go to my slides, we can take you through both some general data that gives you like a scene setting of where people are and how that compares to where we were when we first started doing this in August of last year, and some very specific guidance about mandates in particular, both about vaccination and about testing. So if you can go to the next slide, This is just the overview. This is our 5th wave survey of the data that we're sharing with you. And over that time, we've talked to the general public with very specific oversamples of some of those hard to reach audiences, Black respondents, Latino respondents, and frontline workers, to make sure we really understood if there were gaps, and if so, how to best overcome them in those people who really are at highest risk from adverse events. So you can go to the next slide. The big overview, big takeaways to sort of frame up my conversation are, right now we're seeing a lot of pessimism. People think we're on the wrong track, not surprisingly, given the sort of long slog we've all been through. But the interesting thing that we also see is people feel pretty confident at their ability to protect themselves. They understand what to do with all of these things we've been asking them to do. And you'll see that people have started doing them again. So there you saw a decline, and now you see it come right back up as the Delta variant spread across the country. We see some interesting support for mandates. I would say the takeaway is it's soft support. It is not as polarized as you might have been led to believe, but there is not a lot of consensus either. But one really interesting thing is that there is pretty strong support for workplace testing. Most people see that that would make sense to them, and I'll take you through some data on that as well. So if we can go to the next slide, go to the next one after this. This is our key attitude question. And as you can see, we've been asking this for 16 months now. The important thing is really to look at that May to September data, where you saw people who perceived COVID as a big problem almost doubled after almost cutting in half from February to May. So if you think of May as sort of like the high point, that moment when we all thought these vaccines, you saw the enormous uptake, you saw the decline in cases, everyone thought we really had licked this thing. And then over the summer, people saw that that wasn't the case. And what they had hoped to have a far more normal second half of their year was unlikely to happen. If you can go to the next slide, a little more granularity on this. We asked that very typical polling question of, do you think we're on the right track or the wrong track? And you see, again, that sense of being headed in the right direction was cut in half over that several month period. So this is where people's minds are, right? They're sort of, it's not just that confidence is low, is that it's a big drop from that sense of optimism that we had in the spring. If you can go to my next slide, here's the really interesting thing. People just sort of swung right back into action. So we've been tracking since August of 2020, all of the things that people were asked to do. And the key thing here is most people are doing the right thing most of the time. When you look at these numbers of people who say they are washing their hands, they're wearing a mask, they're socially distancing, we added the vaccine question as soon as it became clear that the vaccines were actually going to happen. So this is the interesting thing, is people have internalized this. You saw it sort of drift downward over the course of the year and then pop right back up in September. And so what that says to us is people know these things work, they understand how to do them, and they're equipped to do them. Nobody had a mask, or very few of us had masks in the spring of 2020, and now all of us have them all cluttering up all our drawers, and we just pulled them all back out again in September. So now I want to go to some more specific data on mandates themselves. So this is the landscape in which this is fitting. If you can go to the next slide. We asked this question in May, which is we very deliberately phrased it to be provocative. So we sort of pushed the answers as far apart as they could be, where you're looking at safety, big ideas of safety and freedom. Are mandates about safety, or are they about freedom? And what we saw there was soft support. Again, 50% of people are squarely in the safety is the most important thing. About a third said no, freedom is more important. And you've got this 20% of your swing voters in the middle who say, I'm not really sure. So what this said to us is, again, all of the chatter you're hearing about mandates, the reality is a little softer than that. Most people are not quite as polarized as you might have been led to believe. If you can go to the next slide, I'm going to take you fairly quickly through some data looking at all the breakdowns of that question. So the colors, red are people who believe mandates are important to keep you safe. Green is mandates, people should have freedom to decide. And the gray is the people who said, I'm not sure. And what you see is support for mandates increases with age. Unsurprisingly, older people are more at risk. If you can go to the next slide, equally unsurprisingly, I'm sure to most of you, people who lean Democratic are more likely to agree. People who are rural are less likely to agree, but it's not nearly as stark. You sort of hear this whole thing about the big divisions in America today. The rural is lower, but it certainly isn't a drastic fall off from people who live in other parts of the country. If you can go to the next slide. We looked at racial breakdowns and gender breakdowns to see if there was anything that really popped there. Again, you'll see slightly lower agreement among Black Americans. Not surprising given some distrust of federal guidelines, particularly on health issues. But again, not dramatic. It's not an enormous swing between them and other parts of our population. If you can go to the next slide, this is something that we have seen very consistently, which is that COVID protective behaviors travel together. So the way to look at these slides is, again, the same color coding, but we looked at all the other questions that we asked. So we asked, how important do you think testing is to stopping the spread of COVID? How likely would you be to get tested? In both of those cases, the people who think testing is important are also more likely to believe in mandates. The people who say they're likely to get tested, also far more likely to believe in the importance of mandates. If you can go to the next slide, we looked at this a couple of additional ways. We asked about people's belief that vaccines are important and if they are currently vaccinated. And again, you'll see much more agreement with mandates among people who share that belief that vaccines are important and who are currently vaccinated. So all that to say, that was one big way we looked at these. And then we asked another question that said, who's in charge? Who should decide whether these mandates are required? And the interesting thing here was the lack of consensus. People don't really know who should do this. So about 20% said their state, about 30% said federal. Importantly for everyone in this call, another 17% say it should be the individual business, and another plurality saying we shouldn't have these at all. The important thing here is if you can get to consensus, if you can get your state, your federal, your business all aligned, you will have somebody there who 70% of people say, I trust them, or I believe that those people should be the people in charge of mandates. So that unity idea is really important here. If we get people lined up around the same idea, you have a chance to really impact a lot of people. And if you can go to the next slide, we then finally asked about mandates in a different way, much softer and much more specific. So our original question asked in May was about these big ideas of freedom and safety. Our question in September sort of got it down to brass tacks. There are people saying you should get vaccinated if you're going to do things like go to work, go to school, get on a plane, go to a concert. And what you saw here was that got the support for them up by about 10 percentage points. So when you sort of gave people a way to see themselves in the mandate question, they were more likely to agree with it. You can see sort of there's a rational process of, yeah, it might be nice to get on a plane knowing that everyone on the plane was vaccinated, or go to work and know that everyone at work was vaccinated. So that idea of pulling the idea closer to reality, getting more specific, getting out of the abstract discussions helps get people on board with the idea of mandates. So now I want to move to a slightly different question, which is about testing. So we've been asking, if you can go to the next slide and go one more, we ask about testing in a couple different ways. We start to ask this is a clean read just on testing in general. Where would you want to have it? And you see there's about 12% saying at work. So the top of mind are pharmacy, clinic, doctor, all those things you might expect. But then when we asked very specifically, if you can go to the next slide, if your workplace offered it, what would you do? And this is where we saw about 2/3 up to 80% of people saying, yeah, that would make sense. So I'd be very or somewhat likely to get tested if my workplace offered it. And the two bars here, the red are people who are currently going to work. The green were people who are currently working remotely. But what you can see is that doesn't seem to matter. The agreement is pretty steady across both cohorts of workers. So again, that idea that vaccine mandates might be important, but that idea of testing is actually really real. People are very open to it, and it can be a really great additional tool in helping control the pandemic. So with that is the end of my part, and I believe I'm turning it over to my colleague on this presentation.
Hi, everyone. It's nice to be back. Thank you to the Chamber for inviting Civis back to talk about effective messaging for COVID-19 vaccines. Greetings from my glamorous basement. Civis is a data science advisory and technology company, and hopefully you were able to join in on the call we had earlier this year. But if not, I'll talk a little bit about what our company does. We've done a lot of work measuring public opinion on COVID-19 and testing how to persuasively communicate to public audiences about vaccines. One of the things that we do is a substantial amount of survey and polling, but we also do randomized controlled experiments of different messaging themes in order to figure out what is most persuasive for particular groups. We won't have a lot of time to go into the methodology behind what we do, but I would encourage you, if you have any questions about that, to visit our website. Next slide, please. Yep, if you could proceed to the next slide. There we go. Thank you. So like I mentioned, we have been doing message testing for COVID-19 vaccines since the fall of 2020, actually preceding the release and authorization of the vaccine here in the US. Our latest results were just published in October 2021, and that summarized a test we ran the month previous to that. And those are all available on our website, and I'm sure it can be made available through the Chamber as well. Next slide. So one of the things we wanted to talk about during this presentation is, as mentioned before by Caroline, right now it is a very different environment than what we were in earlier in 2021. We're talking about mandates. And so one of the questions to think about is, should we even bother thinking about persuasion and what is most effectively going to convince people to take it when mandates are on the table? And it's very possible, and actually is a reality for many people already, that people just have to do it. One of the arguments that we would make is that, even setting aside for a second that it's not for certain that mandates will survive challenges in court, there are probably several different reasons why taking an actively empathetic posture of encouraging employees to choose to get vaccinated rather than a hard line, this is just something that is required and you have to do it, might be a good one for employers to take. Next slide, please. First, as mentioned previously, employee attitudes toward mandates are sort of a mix right now. The majority of people that we surveyed who are employees, so they either work part-time or full-time, responded that they do support requirements to get vaccinated in the workplace. But as you can see, there's a substantial number of people who oppose them, 35%. And then if I can draw your attention to the right side, there is a substantial number of people who may be surprising to you who oppose mandates amongst the vaccinated employees. We didn't delve further into exactly the reasons why, but it's very possible that there's opposition to the idea of being told what to do, or there's opposition to sharing some information with your employer that might be considered sensitive health information. Likewise, amongst the unvaccinated employees, we find that about 23% of them support and 62% oppose. And that 23% might be a little surprising. It's possible here that unvaccinated employees who support the mandates are people who have experienced COVID themselves or are part of the rare minority of people who have an issue with taking the vaccines. Next slide. Second, we really encourage employers, according to our data, it seems like employees actually really want to hear from their employers. So 71% of employees said that they want to hear and get information from the people that they work for. We think that employers are in a good position to be a trusted messenger of important information and are in a position where they potentially could correct some misinformation that could be harmful. So when we asked people, do you agree or disagree that your employer should talk to all the employees in your company about COVID-19 vaccines? About 48% people responded that they strongly agree, and 23% said somewhat. Next slide, please. Third, taking this approach might actually offer some opportunities for employers to diffuse tension between vaccinated and unvaccinated coworkers. We're seeing this borne out in the survey data that we collect. When we ask people who are vaccinated and they're employed what level of comfort they have in sharing their personal beliefs about COVID with their colleagues and employers, vast majority say that they would be comfortable, about 85%. But we also see that there's a marked difference between vaccinated individuals and unvaccinated employees. About 67% of unvaccinated employees say that they would actually feel comfortable. And likely it's due to fear of being judged, maybe even fear of repercussions. So if employers can offer some support, some encouragement of a conversation that is mired in empathy, this might be a good way to diffuse some of that tension. Next slide, please. And then last of all, I don't think this is a surprise to any of us that are on this call, but retaining high-performing employees is a huge top challenge for many employers right now. So on the left side, what we're seeing is amongst people who are unvaccinated, when they were asked if your employer required all employees to get vaccinations or take a mandatory weekly COVID test, we found that about 37% said that they would seek new employment, which is a pretty large number. On the right side, in contrast, if your employer did not require all employees to show proof of vaccination at work, and this question was asked of people who are vaccinated, how likely would you be to look for another job? Find that a significant portion of those individuals responded that they would be very likely to seek new employment. This sort of also lines up with a lot of the national statistics that we're seeing. I think there was a report last week by the Bureau of Labor and Statistics that published that quit rates across the country are at an all-time high. We also found, according to a PwC PricewaterhouseCoopers survey conducted in August, about 65% of employees look for a new job. It's not likely that we can just call this, a singular reason that people are saying that they're leaving their jobs, but rather a constellation of things. But it is something to keep in mind that this is one of the top issues that employees are talking about. Next slide, please. So if we should still be trying to persuade people, how do we do it? And what messages do we use? So what you're seeing here is a recap of the latest round of message testing results published just last month. And what we did was we tested 8 different frames or themes of talking about the COVID-19 vaccine. The winning message, or what was called most persuasive, was a message that talked about protecting children. That's the bar that you see on the very left side, the darkest blue, which resulted in a positive 6 percentage points, which just means that that message was likely to cause people to say that they were willing to get vaccinated 6 percentage points more than a control group, which saw no message at all. The second message was one that talked about financial costs of COVID. It was very neutral and just talked about the fact that if you get hospitalized, you could incur some medical bills. You might have to miss out on work, which also poses a financial strain for many. And that was about 5 percentage points increase. When you see that bar across from left to right, that horizontal bar, anything above it is statistically significant, which means that we believe that it is highly persuasive. Anything below it is actually something that is likely to cause negative backlash, which means that a person saw that message and they're more likely to respond that they're less likely to get vaccinated than they were before. Just obviously something that you don't want if you want particularly persuasive messaging. One of the other things that we saw highlighted again, and we see this as a recurring theme across all of the message testing that we've done, is that if you look at the 3 different messages on the right side, scary COVID vaccine statistics, personal story, and vaccine safety, those are messages that had a very negative undertone. They talked about how there are a lot of people who've died. There are a lot of doom and gloom type of feelings, sentiment to those messages. And we find yet again that those messages are really likely to cause negative backlash amongst unvaccinated people. A couple of weeks ago, I think there was a peak, but it seemed like in a lot of the headlines, we were seeing stories about patients that were on their deathbeds, patients that, testimonials from physicians. The message that we tested here was actually taken from an ER physician in Alabama that talked about how unvaccinated people were dying and had asked for the vaccine, and she was not able to give it to them. That's one of the reasons why we wanted to test that framing here, was because it was so pervasive. And what we were finding is that although that feels intuitive and it feels like the right approach, our testing doesn't suggest that that would be helpful, and actually would suggest that that would be a negative approach to take and result in a lot of the opposite intended effect. Next slide. So more so than ever before, what we see is that what's most persuasive overall for all unvaccinated people that responded to our survey was the protecting children and the financial costs message. But when we actually dissect and looked further into smaller subgroups, we find that smaller subgroups can respond wildly different in different ways than the average across the board. So one example of that is that vaccination likelihood for Latinx respondents, the most persuasive message was protecting children, but you can see close runner up is the patriotism message, which talked about how vaccines are an example of American patriotism. So this is just to show that there can be very different effects at the large group and small group level. And so we want to be careful about messaging nuance, and what may be persuasive for some may not be for others. Next slide. This is the last one. So now more than ever, to be both maximally persuasive and minimally antagonizing or causing negative backlash, we think that knowing your employee is really crucial. So we're really glad to participate in forums like this, where we can share some of the data describing how employees think, feel, and act. We want to encourage you to look at some of the resources that the Chamber has provided. We found that very helpful, as well as, coming to the CIVIS website and referring to any of those as guidance. Thank you.
Sorry. Thank you. That was great and very informative. We have just a couple of minutes for audience questions. So want to sort of shoot these at both of you as sort of rapid fire, and then we can follow up with attendees post-event. So one question that we saw come in from a few folks was, are there any messages that you have or data behind how the messages are working for those outside of the US? So what types of messages and information has been effective outside of the US in terms of helping move employees toward vaccination?
Yeah, unfortunately, our surveys have all been US only, so I don't have anything to add there.
Yeah, I'm sorry. Ours are the same. Yeah, so we can only speak about US respondents.
Okay. So Carrie, you mentioned some data about willingness to stay home. Had a question about whether or not that meant that half of people are not willing to stay home when they're feeling ill.
No, that is actually a great clarification, which is the question was, how willing would you be to do any of the following to reduce your risk of infection with COVID-19? So it was more in the social distancing, kind of flatten the curve conversation, rather than the if you were sick, would you stay home? So it was more to reduce the risk of spread.
Okay. Crystal, how much are attitudes about vaccination mixed up with self-identity? Could you expand on that a little bit?
Yeah, unfortunately, it's not one of the things that you can just pinpoint and dissect how much of the attitude is contributed to because of factor A, B, or C. But if it's like anything else that we test on and survey on that has a lot of sensitivity around, whether it's politics or healthcare issues, it's probably a constellation of all of those different things. ranging from where you are in the country, how old you are. We know demographics play a lot of role in what your perception of the vaccine is, but also, you know, the people around you as well. So I think there's a lot.
Okay, and so now as many Americans have been getting their booster shots and more planning to in coming weeks, do you have any data about how folks are viewing booster shots, as well as the idea of, you know, needing continuous or annual, you know, COVID vaccines to ensure their protection against the virus?
We haven't asked about that. Our next wave is in January, and I think those are the kind of things we're going to ask about then. Certainly uptake of boosters, feelings about boosters, and this idea. I think there was so much focus on when will it end, and the answer is slowly but surely turning into never. And the question starts to be, how do we manage it rather than how do we hold tight till it ends?
Yeah, we've been asking about boosters on our weekly national surveys that we run. I don't have the data at my fingertips, but I do know that recently reviewed the awareness of boosters and whether people understood if they qualified, if they actually even would be eligible. And it seemed to be a lot of confusion. So, I mean, I think with that, there may be a baseline foundation knowledge gap that has to be overcome.
Okay, and to try to end on some positivity, wanted to ask each of you to respond to what gives you hope that we, you know, as a country, but employers more in particular, for the audience tuning in today, will be able to find the right messages in talking to employees and others about vaccination.
Yeah, I think it's where I started, which is that most people have been doing the right thing most of the time. And I think that's sort of the huge missed opportunity. We are very social creatures. So if we had focused from the beginning on the people who are doing things right, rather than the far smaller group of people who are doing not doing those things, I think we'd be in a better place. And I think we're still there, right? But there's we're influenced by social proof. If you hear that 80% of your coworkers are perfectly fine getting vaccinated and getting tested, that's a very different message than seeing endless focus on a very small percentage who are saying no. And I think that's the shift that would be really helpful, because a big thing we saw very early on was most no's were not really hard no's about the vaccine. They were not yet. And we've seen that happen as people move from the not yet until the now. I've seen enough friends and colleagues and family members getting vaccinated that I'm doing it too. And I think that's where I would focus, is how do we celebrate the positive, because that will help encourage the holdouts.
And for me, I think what's most hopeful is that there's still so much interest in it, whether it's from invitations to venues like this, or from client organizations that we work with, from the government. There's an immense amount of interest, and there has been since the beginning, on how to speak to people in a right way that is convincing, and also not going to cause people to have negative backlash, or the opposite of what you want to actually accomplish.
Great. Thank you both again. And I will hand it over to Carolyn Colley to close out today's program.
Great. Thank you so much, Hillary. And thank you, Crystal Sun from Civis. It was great to have you back again. And I hope that you have an open invitation to come back yet again. Same for you, Carrie Shum from Hadaway Communications. I think you both gave our audience really productive and constructive information and recommendations. And, I think, look, we know that messages matter a great deal, and so do messengers. I think what makes me feel hopeful and positive, if Hillary were asking me that question now, is that we know that employers can be very effective messengers. And I think this information today will help employers in a lot of places be even better at that. So we really appreciate your insights, and it's great to know that there is room to go and positive places to go. So thank you very much. And to the audience, thank you for joining us today. If you're looking for additional resources on how to navigate the OSHA rules, please know that the Chamber has published a guide. It's available online detailing which businesses will be subject to the new ETS, which kinds of employees need to be vaccinated, options for unvaccinated employees, and more. It's a lot to navigate ahead, but we're confident that together we can do this. The link is on your screen, and we'll share it with you in an email after this event as well. So please know we're here to help, and I hope that you'll consider the U.S. Chamber of Commerce Foundation a resource and a friend in this effort. Thanks again for joining.